Welcome to section 1 of immunology. In this section, we'll be discussing lymphoid organs. Let's get started. The lymphatic system is a group of tissues that remove waste, facilitate immunity, and transport lymph. Organs of the lymphatic system include primary and secondary lymphoid organs. Finally, you should know that the right lymphatic duct drains the upper right aspect of the body back into the vascular system, while the thoracic duct drains the rest of the body back into the vascular system near the heart. Let's show an image of this so you can see what I'm talking about. Here's a nice image showing the lymphatic system. Before we talk about the table, notice that the top right side of the patient is highlighted right here. This is because this part of the lymphatic system drains into the junction between the right subclavian and internal jugular vein. So we can see the internal jugular vein right here, and we've labeled the entrance of the thoracic duct into the right subclavian right here. The left side is not highlighted, and you can see that this part of the lymphatic system drains into the junction between the left subclavian and internal jugular veins right here. From the image, we can also see other important structures of the lymphatic system, such as the bone marrow, thymus, various lymph nodes. For example, here is a cluster of lymph nodes, the spleen, and Peyer's patches. Finally, notice that many of the major lymph node regions, along with the area that is drained into these regions, is shown in the table. Most of these should be pretty intuitive if you have learned cardiovascular anatomy. For example, the celiac lymph node region drains the liver, stomach, upper duodenum, spleen, and pancreas, just like the celiac artery supplies these structures with blood. Similarly, the inferior mesenteric lymph node region drains the splenic flexure of the colon to the upper rectum, just like the inferior mesenteric artery supplies blood to the same region. So my recommendation would be to not focus too much on this anatomy. Rather, spend your time memorizing vascular anatomy, and the lymph node regions should be easy to figure out based on this information. We talk about vascular anatomy in much more detail in our anatomy section, so I'm not going to spend more time on this here. For the remainder of this lecture, we'll focus on the functions of the primary and secondary lymphoid organs. First, let's go over how the lymphoid organs are categorized. Lymphoid structures are considered either primary or secondary based on their function. Primary organs include the bone marrow and the thymus, which are involved with immune cell production and development. Bone marrow is the site for all immune cell production as well as B cell maturation. So when you think of the bone marrow, think of B cells. The thymus is the site for T cell maturation. So T cells. These two structures should be easy enough to remember, B for bone marrow and B cells, and T for thymus and T cells. Just remember that the bone marrow produces both types of cells. In other words, the bone marrow produces B cells and T cells, but the B cells more specifically mature within the bone marrow, while the T cells mature within the thymus. Next, we have secondary lymphoid organs. These organs function to allow immune cells to interact with a given antigen, so antigen interaction. They do not directly produce any cell type, but rather help develop preformed adaptive cells. Secondary organs include lymph nodes, the spleen, tonsils, and Peyer's patches in the small intestine. The bone marrow is composed of red marrow and yellow marrow. Red marrow is composed of the functional active cells of the bone marrow that produce immune cells. Yellow marrow is composed of fat cells and is considered inactive. The function of the bone marrow is to produce both B cells and T cells. B cells also develop in the bone marrow, while T cells are transported to the thymus and develop there. Here's an image of bone anatomy. We can see the yellow bone marrow right here and the red bone marrow right here. The next primary lymphoid organ is the thymus. It's located in the anterior superior mediastinum and is derived from the ventral wing of the third pharyngeal pouch, which is endoderm. However, the thymic lymphocytes themselves are derived from mesoderm. If you want to learn more about embryology of the thymus, I'd recommend watching section 7 of reproductive embryology. As we discussed earlier, the thymus is the site of T cell maturation. It's most active during the neonatal and pre-adolescent period of development, because this is when all of the T cells undergo maturation. The thymus eventually atrophies and is replaced by adipose tissue as a person matures into adulthood. At this point, your lifetime supply of T cells has already been developed. However, your T cells continue to differentiate in secondary lymphoid organs when needed to fight infection. So differentiation occurs in secondary lymphoid organs. Here's a chest X-ray of a neonate. You can see a prominent region right here, which is the thymus. This is a pretty classic image and has what's known as the characteristic sail sign. If you outline the edge of the thymus like this, you can see that it kind of resembles the sail of a boat. Here's a histological image of the thymus at a low magnification. 1 represents the thymic capsule. 2 represents the cortex. This is where the immature T cells reside. 3 represents the marrow or medulla. Notice that this region is much paler than the cortex. This is where the T cells migrate as they mature, so it contains mature T cells. 4 is a bit hard to see at this magnification, but it represents a Hassel's corpuscle, which I'll zoom up on in a second. Finally, 5 represents the connective tissue of the thymus. So if we zoom up on the medulla of the thymus, we can see an area like this, which is a Hassel's corpuscle. The actual function of this structure is currently not very well understood, but it's an important histological structure for you to recognize because it's distinct and lets you know that you're looking at the thymus. Here are a couple of important associations to make regarding the thymus. First, absent thymic shadow is a term that comes up frequently in exam questions. This basically means that the thymus does not show up on a chest x-ray in a neonate. This is an indicator of immunodeficiency and is often seen in DiGeorge syndrome and severe combined immunodeficiency, or SCID. We talk more about these disorders in our lectures on immunodeficiencies. A thymoma is a neoplasm of the thymus and is associated with diseases like myasthenia gravis, Good syndrome, superior vena cava syndrome, and pure red cell aplasia. Finally, autoimmune polyendocrine syndrome 1 is associated with a mutation in the AIR genes present in the thymus. Basically, this mutation results in autoreactive lymphocytes that damage different tissue in our bodies. It's a result of negative selection failure in the thymus. We will discuss the processes of positive and negative T cell selection more in the upcoming videos on T cells. All right, that's all for primary lymphoid organs. Now let's discuss secondary lymphoid organs. Again, secondary organs include lymph nodes, the spleen, tonsils, and Peyer's patches. Let's discuss lymph nodes first. This is an image of a cross-section through a lymph node. As you can see, many afferent lymphatic vessels drain into the lymph node, and then the lymph exits through a single efferent vessel. The lymph node is surrounded by a capsule, and it has trabeculae, which are just segments of supportive connective tissue that invaginate towards the center of the lymph node. The lymph node is further broken down by 3 main areas: the cortex, paracortex, and medulla. The cortex includes primary and secondary follicles. The paracortex is right here and is where T cells reside. Finally, the medulla is right here and includes medullary sinuses and medullary cords. The medullary cords are areas of lymphatic tissue that invaginate into the medulla, and the medullary sinuses are the spaces between the cords. Okay, now let's cover each aspect of the lymph node in more detail. First, we have the cortex, which houses the follicles. Follicles consist mainly of B cells and are the site of B cell localization and proliferation. There are both primary and secondary follicles. Primary follicles are areas of dormant B cells, whereas secondary follicles are areas of active B cells. Secondary follicles can also be further broken down into 2 areas: the mantle zone and the germinal center. The mantle zone contains resting and memory B cells and is associated with mantle cell lymphoma. The germinal center is an important area where somatic hypermutations occur. This is a topic we'll cover in more detail in a separate lecture, so don't worry about it at this point. From the image, we can see the primary follicle, secondary follicle, germinal center, and mantle zone. Again, notice that these are all part of the cortex. Next is the paracortex. It consists of mostly T cells, and it's the region where T cells interact with dendritic cells in order to become activated. The paracortex is also the home of the high endothelial venules, which is where the lymph enters the lymph node. In terms of disease associations, it's important to know that the paracortex is the region of the lymph node that is underdeveloped in patients with DiGeorge syndrome. Additionally, the paracortex is the portion of the lymph node that becomes enlarged in a patient that has lymphadenopathy. From the image, we can see the paracortex right here, which again is where many T cells reside. So lymph travels to the lymph node through afferent lymphatic vessels and then enters the lymph node through high endothelial venules, which are present in the paracortex right here. Finally, we have the medulla, which can be broken up into the medullary cords and the medullary sinuses. The medullary cords are areas of lymphatic tissue that invaginate into the medulla, and the medullary sinuses are the spaces between the cords. The cords contain plasma cells and lymphocytes, and the sinuses contain macrophages and reticular cells. Finally, the medullary sinuses communicate with the efferent lymphatics. From the image, we can see the medullary cords right here and the medullary sinuses right here. Here is a histological image of a lymph node. In this image, we can see the cortex right here, along with a follicle in the cortex right here. Deep to this region is the paracortex, roughly right here. followed by the medulla right here. All right, now that we've covered lymph nodes, let's move on to discuss the spleen. This is an image of a cross-section through the spleen. Notice that it's surrounded by a capsule, and its vascular supply includes the splenic artery and vein. There are two major regions of the spleen, including the red pulp and the white pulp. The red pulp is a region rich in red blood cells, and the white pulp is a region rich in white blood cells. Let's discuss the white pulp in more detail first. The white pulp includes follicles, the periarterial lymphatic sheath, and the marginal zone. So some of the blood entering the spleen through the splenic artery travels into the white pulp, and this entire region surrounding the artery is a dense area of lymphatic tissue known as the periarterial lymphatic sheath. So right here, we can see many similar areas in this image, but we've only labeled two areas, as you can see. If you think about this name, it's a perfect description of the anatomy. There is a lymphatic sheath surrounding the arterial supply of the spleen. This region has a high concentration of T cells. So notice that any region where the bluish purple color is surrounding an artery is considered the periarterial lymphatic sheath, or PALS. Within the PALS, we can see follicles, which are similar to the follicles we saw in the lymph node. So there's a follicle right here, right here, etc. And this region has a high concentration of B cells. So notice that we've shown B cells in parentheses right here next to the follicle. The central region of the follicle is called a germinal center, and the outer region is known as the mantle zone. Finally, the marginal zone is the area which surrounds the periarterial lymphatic sheath and is also the region that separates the red pulp from the white pulp. Again, we can see the marginal zone right here. Notice that we've stated that this area is rich in macrophages and specialized B cells. This is also the area where antigen-presenting cells bind to blood-borne antigens and then present these antigens to surrounding lymphocytes. We'll talk about many of the details associated with these structures as we progress through the chapter, but for now, just know that these structures allow the immune system to interact with the blood and ultimately make it easier for the body to initiate an immune response. So to review, the white pulp includes follicles, the periarterial lymphatic sheath, or PALS, and the marginal zone. The follicle is rich in B cells. The PALS is a dense area of lymphatic tissue surrounding the arteries and is rich in T cells. And the marginal zone is an area that surrounds the PALS and is rich in macrophages, specialized B cells, and antigen-presenting cells, or APCs. Okay, that's the white pulp. Now let's discuss the red pulp. The red pulp has one major purpose. It filters the blood. Let's walk through how this happens. The splenic artery branches into smaller arteries, which are known as end arteries. These are unique because their structure allows the cells in the vasculature, such as red blood cells, to flow into the surrounding tissue. They also don't directly anastomose with other vessels, hence the name end artery. This type of circulation, which allows the blood to flow into the surrounding tissue, is also known as open circulation. However, not all of the vasculature is this way. Some of the arteries directly flow back into the venous system, and this is a closed circulation. So you can see in the image that we've shown an end artery directly anastomosing with the venous portion of the spleen, and this is considered closed circulation. If there is no anastomosis, it's referred to as open circulation. So the blood from the end arteries enters the surrounding space, which is known as splenic cords. From here, most of the blood will enter what's known as sinusoids. These are wide veins that have a fenestrated basement membrane and allow red blood cells to slip through. Once the red blood cells enter this area, they go to the venous system and ultimately leave the spleen through the splenic vein. So what's the point of this elaborate blood filtering process? Twofold. First, it allows the body to get rid of old or damaged red blood cells because these cells are unable to enter the sinusoids, and they end up getting removed from the circulation by splenic macrophages, which happen to be heavily present within the splenic cords. Notice in this image that we indicated that the splenic cords contain macrophages. And second, it acts as another layer of immunity because the macrophages can interact with antigens and pathogens that may be present in the blood. So to review, the red pulp filters the blood. Blood travels from the splenic artery to the end arteries into the splenic cords, then the sinusoids, and finally back into the venous system. This is important because it's a way to remove old or damaged red blood cells, and it serves as another layer of immunity. All right, that's all for red pulp. Now let's discuss some other important spleen associations you need to be familiar with for step 1. The spleen can become dysfunctional for various reasons, such as sickle cell disease, infection, infarction, or trauma. Regardless of how it becomes dysfunctional, you should know that this results in decreased splenic B cells, which leads to decreased IgM. IgM is important in activating complement, so there is decreased complement activation. We'll talk more about complement in a separate lecture. Additionally, C3b is a component of the complement system that's important for opsonization. So if complement activation is impaired, then it logically follows that opsonization is also impaired. Ultimately, these factors result in an increased risk of infection by encapsulated bacteria. And this is because opsonization and complement play an important role in eliminating these pathogens. This is why it's especially important for asplenic patients to receive vaccinations against encapsulated organisms, such as Streptococcus pneumoniae, Haemophilus influenzae type B, or Hib, and Neisseria meningitidis. Another important association to be familiar with is regarding post-splenectomy findings. The Howell-Jolly bodies and target cells are abnormal features of red blood cells that can be explained by a decrease in splenic macrophages. As I mentioned a minute ago, the splenic macrophages in the red pulp are involved in clearing old and damaged red blood cells. Therefore, a patient without a spleen will have these old and damaged red blood cells that persist in the circulation. Howell-Jolly bodies are simply nuclear remnants in red blood cells. When a red blood cell leaves the bone marrow, sometimes a nuclear remnant persists, and this is removed from the circulation when it reaches the spleen. However, if the spleen isn't working, then Howell-Jolly bodies may be seen. Target cells can be seen in a number of diseases such as liver disease and hemoglobin disorders. There is normally a small amount of these cells in the circulation, and without splenic macrophages, they may persist in the circulation. Finally, you should know that a large population of platelets and lymphocytes are stored or sequestered in the spleen. So when the spleen is removed, these patients can develop an increase in these blood products, resulting in lymphocytosis and thrombocytosis. Here is an image of a Howell-Jolly body. You can see the purple dot here, which is a nuclear remnant. Its presence is evidence that the patient may have splenic dysfunction. Here is an image of target cells. You can see one, for example, right here. Notice that they look like little targets. All right, that's everything for the spleen. Let's finish by discussing tonsils and Peyer's patches. Here is an image of the tonsils. They are quite large in this patient, and you can see them right here. There isn't too much you need to know about this for step 1, other than the fact that they are collections of lymphoid tissue. It's part of the lymphatic system and can become quite enlarged during various infections. Adenovirus is a classic virus that causes pharyngitis with very large tonsils. Let's finish by discussing Peyer's patches. These are collections of lymphoid tissue in the ileum of the gastrointestinal tract, specifically in the lamina propria and submucosa. Within these regions, there are M cells, which sample and present antigens to nearby immune cells, which results in B cell activation. From here, the B cells become IgA-secreting plasma cells, which can be found in the lamina propria. The IgA is transported to the intraluminal space with something known as protective secretory component, which is simply a polypeptide that wraps around IgA and helps protect it from cleavage. We'll discuss this idea in more detail when we discuss immunoglobulins. Here's an image of a Peyer's patch circled in red. Again, this should immediately clue you in on the fact that we're looking at the ileum. All right, now that we've covered the information, let's review with a question. A 4-year-old boy presents to the physician with a cough, runny nose, conjunctivitis, and pharyngitis. His symptoms first started 2 days ago. Physical examination reveals several tender lymph nodes in the neck. It's concluded that intracellular viral particles are responsible for his symptoms. These infected cells can be neutralized by T cells, which are primarily found in which region of the lymph node? Okay, from the question stem, hopefully you notice that this boy has a viral infection. He has a cough, a runny nose, conjunctivitis, and pharyngitis, which sounds like a pretty typical cold. The question also mentions viral particles and states that these infected cells can be neutralized by T cells. Recall that T cells are primarily found in the paracortex of the lymph node. So the correct answer is paracortex. From the image, we can see the paracortex right here, which again is where many T cells reside. And that concludes this section.